Facebook. So I am live on Facebook, and I'm just gonna wait a minute for people to join. And I do recommend following us on Facebook because we are sharing our clients reversing their autoimmune symptoms and lab work. Okay, so one of us recently asked, what is that? What is the long-term success? So if you want to see long-term success, make sure that you follow our Facebook and actually seeing our posts. So I am live on Facebook, and I'm gonna do a quick Q&A, and I really want to talk about a really important topic. First of all, it took us 10 years to build a track record. Some people, they assume that they can become an expert by reading a book, or maybe getting a degree, writing a book. It would be like a ticket to the successful career. That's what people are thinking. And before we started helping people globally, we were working with people locally to make sure that what we do actually works for them. On top of that, we have invested $500,000 into education in the last 5 years alone. So learning how to reverse disease is not just of having the right process. You have to invest time, you have to invest energy, you have to invest money, and most likely sacrifice your personal life to acquire that experience. And so who do you listen for health advice? Someone emailed us earlier that she ended up working with a medical doctor, and he only has 5 client videos in the whole year. He only posted 5 client videos in the whole year. So he doesn't have success rate, or doesn't have as many clients to be able to show you that he has helped at least 100 people. So you have to find a person. We have helped at least 100 people that change their life forever. And also, you have to be a visual example of health. How can someone help you if they haven't personally helped hundreds of people get results? And also, somebody asked us recently, do we have long-term results? Every day, we are sharing how people, with our help, are reversing the inflammatory symptoms, and I'm going to talk more about how to understand your lab work. And also, we do share our client labs, how labs are improving. In addition to that, we do share that daily. We have client videos. We really understand their history, their personal story, because we have worked with them every single day over the course of several weeks. So how do you know somebody can help you is that they do share results publicly. There was a woman who stole a client videos, and she was posting them in her private Facebook group. And then when we found out, she changed her Facebook group and her website. So she was actually scamming people by stealing our posts and our client testimonials and posting it in her private group and claiming it as her own. So how do you know someone is scamming you? Is that they're not sharing their results publicly. Don't just look and sit in their Facebook groups, but go to see what are they sharing publicly, okay? And do they actually have the results that you want? Okay, so this is what I want to talk about is, let's see. That's why you can't really generate success unless you have helped hundreds of other people. This is what I want to talk about. And in this video, let me just scroll up a little bit. Let me see if I have any questions here.
It's me.
Oh, hi Darby, I see that you're watching. Yes, so if anybody's watching, if you have any questions for me, let me know. So one thing that I want to talk about next is how to understand your blood work, okay? So first of all, as a reminder, make sure that you follow our page to get notified when we post. Otherwise, Facebook will hide the post. So a lot of people, they're actually misled by their lab results. For example, it is normal when you are healed from a disease to have lower HDL levels as a result of your cholesterol dropping as well. So HDL is considered your good cholesterol, and LDL is considered your bad cholesterol. So when your overall cholesterol goes down, then your body doesn't need to make as much of good cholesterol, HDL. So that's why it's normal to have lower HDL levels as long as your overall cholesterol drops, when you're in a very healthy, optimal health. In addition to that, when you have low inflammation in the body, the white blood count might be lower than the number written down that is the lowest. And the white blood count, it's a representation of your immune system. It represents your inflammatory immune system, and every person, regardless how healthy they eat, they have some kind of inflammation in the body. This is their white blood cells will be a little bit elevated. However, when people who work with us, they reverse their autoimmune disease, they become the healthiest they've ever been in years. And they have very little inflammation in the body compared to the average person who has some kind of inflammation. And therefore, we frequently have clients fully reverse their autoimmune disease, have no symptoms for months after working with us, no more autoimmune antibodies, and tons of energy, and they feel great. And therefore, they might have lower than the average number of their white blood cells. So you really have to understand what is happening to the person and what are they going through to be able to understand their blood work. Okay, so most doctors need to be taught that a healthy person who's following and working with us, they have lower white blood cells is a sign of their optimal health. And if you have white blood cells is low, and you're also healthy, it's a good sign. But if your white blood cells is low, but you also have a disease that's causing it, you also have an autoimmune disease, then it's not healthy, okay? So does this make sense to you? Let me know if you have any questions, and see if anybody's on YouTube watching it here. Does this make sense to you? So if your doctor is not trained in disease reversal, they might have a different understanding of what is happening to your blood work, especially when you're on the way to full healing and recovery. So let's talk about Hashimoto's. Okay, that's what I want to talk about next. Let me see if anybody's in questions. Victoria, you let me know, right? Okay, and I see some people watching the videos, comment under this video and say hi to us, okay? I talked to somebody about Hashimoto's and Graves' disease. So both of these are autoimmune diseases. And her doctor told her that you can reverse your Graves' disease just by taking medicine. And the reason why her doctor told her that is because her doctor does not want to take the time to explain the truth. As you know, your doctor has 10-15 minutes with you, and they're not going to go into details. Basically, the doctors believe that your thyroid is disposable. So they don't treat Hashimoto's or Graves' disease as autoimmune disease because they just wait for the immune system to destroy your thyroid, and they can even remove your thyroid, and you can be on medication for the rest of your life until your immune system attacks other body parts after your thyroid is gone. So taking thyroid medication, whether you have Graves' disease or whether you have Hashimoto's disease, it does not fix the immune system. It can prolong life and it can make your thyroid numbers look better, but it's not going to fix your immune system from attacking your thyroid and destroying it completely, or from attacking other parts of the body. So the doctor will often tell you just take the thyroid or Graves medication, but they don't tell you what to do about it in order to stop your immune system from causing the inflammation on your thyroid and how you can repair it, okay? So we do have a number of our clients who are not on any thyroid medications. Their symptoms are gone. We just talked to our recent client from 5 months ago with Hashimoto's. All her symptoms are gone. We help her understand her lab work. And also her doctor, she just had a follow-up with her doctor, and he noticed her white blood cells went down a little bit, and that's an indication because she has very low inflammation in the body, okay, because she did not have low white blood cells before that. And none of her symptoms are there. She has no symptoms anymore. Another client we checked in with from also 6 months ago, she was diagnosed with multiple sclerosis and gastritis. All her symptoms are gone and they haven't come back, and she's actually getting ready to get pregnant. So she asked us, how can I adjust my diet to make sure that I'm getting everything that my body needs to have healthy pregnancy? And we have worked with people who are breastfeeding. We worked with people in our program. They were breastfeeding while they were reversing their autoimmune disease. We had a client from 2019. She had Hashimoto's, she had fibromyalgia, she had asthma. She was able to heal all her symptoms and still symptom free to this day. And we do share that every day. You can follow our page. If you're missing it, we actually share how our clients are doing from years before, okay? And in addition to that, what I want to share with you is her kids. So her child actually had seizures. and she was able to adopt everything that we taught her about nutrition, and her child stopped having seizures. Okay, so he was having seizures, and this is how nutrition can affect and improve that as well. Okay. And another thing is we worked with a client who had a breast cancer. This is not a topic that I want to talk about, how nutrition affects you in chronic diseases, not just autoimmune diseases, but also things like breast cancer, prostate cancer. So we worked with a client who was diagnosed with breast cancer, and the doctor were going to wait to see when to do surgery for her because her tumor was getting bigger. And actually within several weeks, her tumor shrank from, it was down to 5 millimeters. And they could not even find it in her breast tissue. So we do have a number of people who had endometriosis, who had breast cancer, who had inflammation in their prostate, and they had high PSA numbers. So that's why nutrition is very important in order to stop the progression of these chronic diseases. And one of the classes we taught our clients last weekend, last Saturday, is everything they need to know, all the research studies and publications when it comes to food and preventing these chronic diseases. So we do show case studies, we do share those case studies and all the publications over 30, 40 years that have been published in research, okay? So, yeah, so you're, again, going back to Hashimoto's and Graves' disease, doctors don't treat it as autoimmune disease, they just give you thyroid medication and then the autoimmune disease progresses. And this is why we do have a number of clients who've had Hashimoto's 20 years ago, and then we worked with a person who was diagnosed with scleroderma disease. They put her on a feeding tube. She had a feeding tube in her throat, and we do have her video from 2019. She was able to get off her feeding tube. We worked with her. She had gastritis, scleroderma disease, and she had Hashimoto's for over 20 years ago. Because again, what does the doctor give you for Hashimoto's? They just give you medicine, thyroid medicine, and that's it. But the autoimmune disease progresses and it attacks other cells and organs in the body. So we were able to help her with her gastritis, and she was able to get off her feeding tube, okay? So we have worked with scleroderma, which is affects organs as well. Hi Deborah, good to see you from Australia. What time is it over there? I think it's probably 6 or 7 a.m. for you. Good to see you. Okay, anything else I wanted to talk about? Okay, so please watch to the beginning of this video. And how do you, again, going back to how do you listen to someone for health advice, is that they have the results thereafter, and they also representation of their own health. So unfortunately, there's a lot of people out there who will tell you that they can help you, but they don't have results helping other people. My sister and I started working with people locally. We were actually working with people directly, face to face, and they were paying us $50 to help them with their nutrition, so we can help them with their symptoms and inflammation. And we worked with the people on diabetes, people who have high cholesterol levels, just general health problems. And that's how we started. We started working with people locally and helping them get healthy before we created a program. In addition to that, we have invested over $500,000 in just 5 years alone into our own education, consultants, everything that comes into running a program. So, and I can show proof as well if anybody wanted to see that. So a lot went into our education, a decade of our studies, but also most importantly helping people. That's why we share everything publicly. So Darby asked, can we help people with arthritis? We have shared on this page how our clients with arthritis have gotten better. We have people who had arthritis 20 years and they were able to see improvements. People who had arthritis for 5 years, even though their lab work looked normal, but they were diagnosed clinically and their bones were, they had erosion of bones. So we have shared on this page. You can send us a message and we'll send you more information how we help people with arthritis. So that's why we do have, we share client videos, how they're getting better, but we also sharing their labs when they updated. And then we have email check-ins and communications with our clients every day that we're working with. So we do have all of those details that we can share with you and the kind of experience in the healing that they had, okay, specifically based on their disease, how long they've been sick, and the progress and results they've had in 6 weeks working with us. And also long-term results, because we do check in with our clients long term. Okay, so great question. Anybody has any questions? But you can also go to our page and actually see other people who helped, or send us a message and we'll share it with you. So I think that's all I wanted to talk about. Let me see. I just typed some notes for myself as a reminder to make sure I don't miss anything. And actually with our clients, we do have daily check-ins with our clients, and every day they're telling us what are they eating, how much they're eating. We do help them personalize their plan based on their disease, their symptoms, and we make real-time adjustments based on how the body is responding. So every day we see in their reports, one of our clients emailed us, she has Hashimoto's, high cholesterol, hot flashes. And she had an appointment with her endocrinologist, and her endocrinologist was very impressed with her symptoms improving dramatically, and she encouraged her to continue with what she's doing. Another client with diabetes and arthritis told us day 12 in the program that she's feeling amazing, more energy and mind clarity. She's having less pain, and overall her mood is better. So I actually shared in a Facebook, we have a public group, Facebook group, and I shared a client group. Let me see if I can share it right now so I can read those celebrations together with you. Wouldn't it be great? Let me know if you want, if I can share my screen. Can I share my screen while I'm live here? Or do I have to end this video and share it? Kind of not sure how to do it. Let's see. But I do have it already recorded in a group. We have a public group that you can join. I just haven't approved anyone. In a public group, I actually shared, we have a client group. So how do I share? Does anybody know how to share your screen on Facebook when you're live? Maybe I have to end the video and do it. Not sure how to do it actually. But anyway, we have a client group where clients are sharing their celebrations and progress with other clients who are working with us. And that's what I wanted to read it with you together. But I'm not sure how to share my screen when it's already live. Okay, but I can post it in the comments. So anybody has any other questions for me? Feel free to ask before I leave. In the next 5 minutes, it's already 9 p.m. Eastern time here. Oh yeah, another client with rheumatoid arthritis told us that she had less pain, she went swimming and laid in the sunshine and had more energy. So again, this is another client with Hashimoto's disease, told us that her puffiness and swelling is almost diminished, really enjoying the food that she's eating. Okay, so this is just some of them I'm reading, but Deborah said, I love watching your testimonials, they're very inspiring and give me hope. Thanks so much, Deborah. We appreciate you being here and saying hi to us. In the earlier video, we talked about how interpret lab work when someone is healing. So you can watch the video replay about it. We talked about good cholesterol, we talked about bad cholesterol, and also we talked about white blood count. And then what else we talked about in this video? Oh, and we also shared how a client with Lyme disease, we talked more about that. Okay, so I think I'm gonna finishing up here. Yes, and we did talk a little bit about Hashimoto's disease. How doctors don't treat it, but they tell their patients that you can just take thyroid for your Hashimoto's and it will solve it. For 2 years, and that's all you're gonna need to do. But Hashimoto's is autoimmune disease that's destroying the thyroid. Yeah, and people actually, if your thyroid is completely dead, then people have to be on medication forever, and then the immune system can attack other tissues and in the body. Okay, so Victoria, anything else we should address in this video? Let's see if anybody's on YouTube is watching. I have YouTube connected on the phone. All right. So it's good to see. Then I'm gonna finishing up. Deborah, you have the great day. I know it's morning time for you. And yes, so let's see. Deborah's question just popped up. When cholesterol drops, does the triglyceride drop as well? You do want to see both of these decrease because actually triglycerides and having high cholesterol levels and triglycerides, it's a sign of heart disease. And the doctors who give medications for cholesterol or triglycerides, those medications often cause they actually cause cancer. So when your total cholesterol goes down, your triglycerides also need to come down. What often happens is when your overall cholesterol goes down, it means your body does not need to make as much of good cholesterol. Good cholesterol is called HDL. So that's when our clients are in the optimal health, they've been really healthy for minimum 6 to 12 months, they also notice that they have lower than average numbers of HDL, which is a good cholesterol. And this just means when your bad cholesterol is down, your body doesn't need to make as much HDL, which is good cholesterol, to protect you. Does this make sense? So you do want to see your cholesterol and your triglycerides go down as well, because having high numbers of these is a sign of heart disease. And you want to be figuring out why you're still having those numbers that are elevated, okay? And you do want to see. So Don asked, the medications that they give you for triglycerides that cause cancer. So there are side effects with statins as well, and this is what there's other doctors who've talked about it, because there's medical doctors who help people with their nutrition, but they specifically work with people who have cardiovascular diseases, and there's some of our colleagues, and that's what they mentioned based on their experience and research. So there are medications that are causing, actually the medication that they give people for triglycerides cause cancer. That's what they told us. Let me see. And we did send an email about it earlier. And Don, you mentioned I want to connect with you. Yes, we did respond to your email. It was a few months ago. I'm going to send you an email, okay? I'm going to send you an email. Look for my email and then we can connect. Okay, and then we did send an email more about, Deborah, did you see the email more about the cholesterol? I can send it to you, okay? I can send it to you by email where we do have more information about it. It's so interesting, never heard that you're so smart. What medications are there? Yes, I don't recall what medications it is. I will have to ask. So there's a medical doctor that we work with, that's what he told us, but I forgot the medication name. So I have to reach out to him and ask him what exactly that medication that he was talking about it. Yes, but there are medications that have this type of side effects that they give people. And Andrew said, thanks for going live. Yes, Don, I'm going to send you the email. And Deborah, I'm going to send you the email that will have more about cholesterol where we talked about it, okay? So that's all I wanted to discuss with you. And we'll connect with you by email. Don said, thank you, you're the best. I'm not doing well. Yes, so Don, let's connect. Let's set up a time to talk, okay? But I'm going to follow up with you. And we'll go from there. So look for my email. And Deborah, I'll connect with you most likely tomorrow, okay? Okay, so thank you everybody for joining. And then I will try to go live again next Saturday at this time. And I'll see what topic you want me to talk about next. Please comment under this video. Okay, bye everyone. Have a good night.